Hello everyone. Today we are going to talk about QT interval and its significance in the cardiology. So it is defined as the interval from the start of the Q wave, that is P, Q, this is R, S, and T. So start of the Q wave. So Q wave is starting from this point, that is from this point to end of the T wave, that is this point. So from here to here is called as the QT interval. So basically it denotes what is ventricular depolarization. We start from QRS and the relaxation period, and that is called as ventricular repolarization. So it includes the entire ventricular cycle, that is ventricular depolarization and ventricular repolarization. Effectively, it is the period from the ventricular systole from ventricular isovolumetric contraction to isovolumetric relaxation time. So you can see here, this is a P wave, QRST, and this is the QT interval. That is from the start of the Q to the end of the T. So the QT interval is inversely proportional to heart rate. So basically it depends more on the heart rate. Usually for an ideal QT interval, the heart rate should be at equal to 60 beats per minute. Then you will get the ideal QT interval, because when there is tachycardia, the QT interval will decrease, and when there is bradycardia, QT interval will increase. So you cannot only depends upon the ECG, just on the any ECG to directly calculate QT. It has to be stabilized or equalized to a heart rate of 60. So for a heart rate of, suppose the patient is having 120 heart rate, and now in his QT will be looking short, but you cannot interpret this as short QT interval to label it as normal QT or QT prolonged or QT short. You have to convert this for a 60 heartbeat, how much would have been the QT, and that's why there is the formulas defined for it. An abnormally prolonged QT interval is associated with arrhythmias called as torsades de pointes, and also called as polymorphic VT. When there is different form of VT, it is called as polymorphic VT. As you can see here, the morphology of each Q, this wave is different. So morphology is varying. So unipolar is normally the VT will be like this, monomorphic VT, whereas in polymorphic, the morphology keeps changing. That is one long, one small, and variable sizes will be there. So how do you measure the QT interval? QT interval is usually measured in lead 2 or V5 to V6. However, lead with the longest measurement should be used. Okay, so whenever you're measuring, you take from the QT from the start of the Q and to the end of the T. So end of the T, you label it just for this patient. If it is, since it is a T wave, end of the T starts here. Few patients have also associated U wave, but U wave should not be included. It should be only up to this point only. So you should not include the U wave. So this junction only itself will denote that, that is QT interval. And suppose the U wave is merged with the T wave, then you have to include that U wave also, and the slope should be drawn from the U wave here. So this will be QT interval in this patient. So corrected QT interval is estimates the QT interval at a standard heart rate of 60 beats per minute. This allows comparison to QT values over time at different heart rates, and also helps in predicting that how much is the risk of arrhythmias in these patients. So there are various formula. Most commonly used is Bazet formula, which is, suppose you want to calculate, you do QT divided by RR, that is distance between RR, that you will do in seconds. So whenever you calculate that, you do that in that phase. And Friedrichsia formula is corrected QT, which is equal to QT divided by RR interval in seconds at the rate of 1 by 3. And Framingham formula is given here, and Hodges formula is given here.
So all this RR is basically is the
Preceding is the preceding RR interval in seconds. It has to be calculated in seconds itself. Next is Framingham formula and Hodges formula. These four are the formulas commonly used. So what are the normal QTC value? QTC is considered to be prolonged if it is more than 440 milliseconds in men or more than 460 milliseconds in women. And QTC more than 500 is associated with high chances of torsades de pointes. So QTC is considered short if it is less than 350 milliseconds. Always remember a useful rule of thumb is that a normal QT usually is less than half the preceding RR interval. So if you know the RR interval, QT interval will be definitely usually will be half of that. So for example, if you are seeing this, so this is the distance between R and R. So this is the RR interval and this is the QT segment here. So the QT segment will be half of RR interval, the distance of R from R usually will be half of that. If it is more than half of that, usually it is considered as a prolonged QT interval. Hope you have liked this video. If you have any other doubts, you can do comment in the comment section. We will discuss about long QT syndrome and short QT syndrome in our next video. Thank you.